And the finalists are...
I am very pleased to nominate the Physiotherapy Intensive Care team for their dynamic approach to the rehabilitation of acutely ill patients in the Intensive Care Unit, Craigavon Area Hospital. Early mobilisation and structured rehabilitation, including aquatic therapy, has been led by the physiotherapy team, and this has improved the patient's long-term outcomes and indeed has enhanced their quality of life.
We have been able to now offer aquatic therapy as a treatment option for critically ill, ventilated patients in intensive care. We've been able to take the patients from that environment into our hydrotherapy pool for rehabilitation. We've shown that it's safe and it's very beneficial for those patients.
The reason why I chose the breast cancer team for the Innovation in Practice Award was because they undertook a review of follow-up for breast cancer patients in the Southern Trust. And currently now they have over 70% on a self-management programme.
We feel extremely thrilled and honoured to be nominated for this prestigious award within the Trust. We have introduced a new transforming cancer follow-up pathway for our breast cancer patients. We have organised health and wellbeing events. We have health needs assessment clinics set up and they are running very well. We have transformed the service from a medical model to a nurse-led recovery package, and we have introduced health and wellbeing events, health needs assessment clinics. The multidisciplinary team have been involved the whole way through, and the service has improved immensely and patients provide excellent feedback.
I nominated Ita because she has set up this special clinic for East Timorese ladies who are known to have high-risk pregnancies. She has taken the pressure off all the other GP midwife clinics in the area by doing this, and because she has an interpreter there at all the visits, she has been able to get the women to engage in the service much better. They will attend all their antenatal appointments. She has been able to identify any risk factors with these women and refers them on to the hospital for any intervention or induction to thus reduce the risk of any stillbirths with these wee babies and improve the life expectancies for the mums and the babies.
I've been working with the East Timorese community in Dungannon for about 10 years now. I decided to set up this clinic to be able to deliver a more holistic approach and also to relieve the burden that was on the existing clinics, both midwifery and obstetric. It has had a positive impact on the outcomes for this community.
And the nominees are...
The reason why we nominated Deirdre for this award was because health visiting can be a very stressful job, and Deirdre always offers us her unhurried time with an open door policy, and we greatly appreciate that.
Deirdre's been a great inspiration to the team. It's been one challenge after another since she took up post, yet she's managed to steer us through every one and along the way motivated us to strive and push ourselves to further our own careers and keep providing an excellent service.
I'm delighted to have been nominated for this award. I've worked for the team for the last 3.5 years as their manager, and during that time we've had many challenges which have included staff shortages and also the recent sad death of a long-standing colleague. I have helped the team and supported them through these difficult times, and they're a great team, and I continue to motivate them to work towards a career development so we can continue to deliver a really high quality service to our service users.
I have nominated Melanie McClemens for the Excellence in Leadership Award. Melanie exemplifies all the qualities needed to inspire, motivate and empower her team to achieve the best quality services for their patients and clients.
I'm very honoured to have been nominated for the Taking a Lead Award. My job is about developing services for older people. A very large staff team of 1,400 people, and they make the services happen on a day-to-day basis. My job is to try and lead services for the future, making sure we're involving our staff as we go and making sure, most importantly, we have the voice of older people at the centre of what we're doing and we're shaping services that are right for the future for them.
I nominated Dr. Corky for his achievements in excellence in leadership. Dr. Corky has worked in Daisy Hill Hospital in the Southern Trust for over 34 years, and over that time he's led the transformation of care for children with diabetes in the Southern Trust area, and he's led a team which has been internationally recognised as among the best in the UK for the care of paediatric diabetes.
I was appointed here to Daisy Hill Hospital and the Southern Trust, in fact, in December 1982. Because I had been looking after more children with diabetes in the Southern Trust, both in Craigavon and in Banbridge and here, it was decided that I would take on the care of all the children with diabetes in the Southern Trust. And we've built up a team, initially developing specialist diabetes nurses, or encouraging the appointment of nurses who have worked with me very closely and have set up a clinic which now has some 265 patients. In addition to diabetes, I have been involved in management. I was chairman of medical staff here in Daisy Hill and was clinician for the Southern Trust and as the paediatric lead for several years. I've also been involved in education, involved in the Northern Ireland Council for Postgraduate Medical and Dental Education. Later days I have been involved in starting asthma clinics, epilepsy clinics, and these have also led to the development of specialist asthma nurses and specialist epilepsy nurses.
And the finalists are
I nominated the Education, Learning and Development Department for a number of reasons. Over the last year we faced a significant number of challenges, but yet throughout these we have pulled together, supported one another and seen improved outcomes for our team.
I'm really delighted that the team's been nominated for this award. It's incredible what the team's able to achieve. In the last 2 years we've increased the compliance rate for corporate mandatory training by 30%. We offer 10,000 places a quarter on the training days. It really is incredible what the team's able to achieve.
I nominated the Health Records Department for this Excellence Award. This is a very highly performing and successful department, and there's so much work that takes part behind the scenes just for us to be able to deliver our service that people don't realise.
We are delighted to be nominated for this award. Health Records is made up of 3 departments: reception, portering and records. We all work well together, we're very loyal and hard-working. We cover each other when needed. We are proud of our staff and our department.
I chose the Cancer Tracking Team for the Working Behind the Scenes award because every day they actively track patients who are referred with a suspect cancer to the Trust, and in any given week they could be tracking 1,300 to 1,400 patients.
We, the Cancer Tracker Team, are delighted to be nominated for this award. The Tracker Team work hard behind the scenes to ensure that Southern Trust remain a top performing trust within the region.
And the finalists are
I nominated the Thorndale Urology unit because as part of a multidisciplinary team they have re-looked at the way that they have delivered outpatient urology cancer services for our patients. It is a team approach. We have consultants, clinical nurse specialists, nurses, healthcare assistants, secretaries, admin staff in the booking team and the red flag team, and as a result we've become one of the best performing trusts in Northern Ireland for cancer services.
We are delighted to be nominated for this award. We feel that it is in recognition of the efforts made by the medical, nursing, radiology and medical record support services within our team.
I was delighted to nominate this team because it's made up of individuals who are enthusiastic, energetic, committed, and together they have developed a great project for children and young people that really improves the information that they can access on CAM services.
What young people wanted was a well-presented site with brief information about mental health and our local services, and they told us in no uncertain terms how they wanted the website to be developed. So it was lovely, quite refreshing to work with people who gave such honest feedback.
Beth and I are thrilled and delighted with Stephen's nomination for the Trust Excellence Award. It gives us the opportunity to showcase the hard work and the commitment of our young people and their parents and carers in the development of the CAMS website.
I nominated the Minor Injuries team for the Excellence Award because I'm extremely proud to be part of the team of emergency nurse practitioners, staff nurses, healthcare assistants and clerical staff who deliver a leading, flourishing service within emergency care despite a 50% increase in attendances. This nurse-led team has championed to promote and develop a service that delivers safe, high-quality care and a culture and environment of dignity and respect for all its service users. Transforming your care has been the care ethos of our trust for the past 5 years, and South Tyrone Minor Injury Unit is a high-performing and visible example of this at work.
We're delighted to be nominated for Team of the Year. We became a nurse-led minor injury unit about 10 years ago, and we're expected to see around 15,000 patients. This year we've seen almost 29,000 patients, double that of what was expected. Together as a team, we work tirelessly to provide a high-quality service for our local community and beyond.
And the finalists are...
I recommended the Dementia Care Centre. My mother attends here daily, and I have been very impressed from the word go in that her personal needs were identified by the duty manager, Joy Walker. On first visiting the centre, my mother was treated as a person. Her daily needs and interests were the focal point, and she was spoken to as a person, and that's what impressed me. I have been very impressed by how my mother has developed. She is stimulated, there's lots of activities happening, but very much a personal service and very much directed at her.
I would like to thank Helen for nominating Edenderry Day Centre. Edenderry Day Centre is an exemplar of good, positive dementia care practice. The staff team are passionately committed to ensuring that all people with dementia who attend the centre have a high quality service. This ensures that carers like Helen are confident that their relatives are well cared for and have an enjoyable experience, which has a hugely positive impact on their quality of life and ability to continue to care.
I've nominated Jane Ferguson for the People's Choice Award. Jane brought a huge amount to the Hardy Lives project here in Craigavon Travellers Support Committee. She made a good project excellent, and without her it wouldn't have succeeded in the way it did.
I am honoured to be nominated for this People's Choice Award. I've thoroughly enjoyed working within the Hardy Lives Craigavon project, working with Irish travellers and black minority ethnic groups, improving their awareness of cardiovascular disease and its risk factors.
And the finalists are...
As a stroke team, we'd like to nominate Diane Crooks for this Excellence Award. Diane's contribution to stroke services and her excellence with all the team and all the patients has been greatly appreciated by all the stroke team.
I'm delighted to have been nominated for this Trust Excellence Award. I have been nursing within the Southern Trust for the last 37 years and within stroke care for 32. The patients are at the heart of my role, and I really love the job that I do.
I nominate Tom Hyde for his many years of dedicated service as hospital porter in Craigavon Hospital. Tom is known by everyone for his valuable help and assistance, and he's an excellent role model to all.
I do love working here, and I gel well with the rest of the staff, medical, nursing, clerical, all the staff. I've been here for a total of 28 years. I had a break in between, and then when I come back again, I worked 3 years voluntary, 30 hours a week. I have to say I'm very pleased to be nominated.
We nominated Christopher for a Lifetime Achievement Award on behalf of all the members of staff here in the laboratory. He's been with us for 42 years now, and we are going to miss him tremendously.
The job has changed quite a bit since I started. We had a room full of chemicals and balances, Bunsen burners and that, and it was what everyone imagined a lab was like. Over the years, the job utterly has evolved. Computerisation came in, and it's so different now. You come in, sometimes you think, I'm going to the dentist. When I come in, it's so clean and white. After 42 years, I am going to retire in July. I think I'm going to really miss the place. I'm certainly going to miss the people, and you know, they might even miss me.